Awesome, awesome. And then again, we'll open up for questions in a minute. I wanted to actually end with Nick, since he has a video. And so I would love to ask Charles Stevens from AIDS United, who focuses on advocacy for black men who have sex with men, to please... were those Nick's? I'm sorry.
I can go.
No, I want to do him. I want to do Charles. I think in the wake of the new information this week that Charles has a lot of important information to share with us.
Hello everyone, I'm Charles Stevens and I'm the Southern Regional Organizer for AIDS United. And today I have the opportunity to certainly talk about stigma and HIV stigma, but further contextualize that around young MSM in general and young black MSM in particular, looking at the intersections of anti-gay stigma and HIV stigma. So I want to begin by talking a little bit about anti-gay stigma, grounding that, and then HIV stigma. Then I'm going to talk about some of those intersections, like how they interact. And then finally talking about implications for policy and advocacy around countering stigma. And leaving you guys off with just talking a little bit about the work that AIDS United is doing. So when we talk about stigma, we talk about a mark of disgrace, infamy, reproach, definitely targeting marginalized folks, marginalized populations. Examples, and again, talking about anti-gay stigma, some of those very specific examples of stigma, particularly targeting MSM or certainly gay communities, rejection by family and loved ones, discrimination and harassment, and certainly there's been a lot of information about bullying and how that young LGBT folks are particularly vulnerable to bullying in schools and such. Historical example I wanted to point out, particularly in this nation, were certainly the sodomy laws that existed in a number of states for a number of years before it was overturned by Lawrence v. Texas. And then physical and emotional violence. So that might look like everything from taunting to harassment, again, bullying, like very specific examples of that. According to the CDC, stigma against MSM can lead to lack of high quality of health care. That means as one enters a healthcare setting, the kinds and the quality of healthcare that they receive from direct service providers, clinicians, et cetera, like how they're impacted by that. Can also affect income and employment status. And one of the things that I think is really valuable and critical is that, the conversation around HIV prevention in particular is really moving, I think, away from just individual level behavior and increasingly looking at structural forces, looking at social forces, social drivers like economics, job stability, and things like that. Stigma can also contribute to poor mental health and unhealthy behaviors, including substance abuse, risky sexual behaviors, and suicide attempts. And it's important to reference particularly mental health stigma because the thing with social stigma is that they typically reinforce each other. So the stigma around mental health could reinforce the stigma around HIV, could reinforce the stigma around anti-gay stigma. And particularly with, I would say, young LGBT folks and specifically young black gay men, we see high levels of depression, we see high levels of suicide. So all of these things really work together. It also creates an inability to establish and maintain long-term same-sex relationships that might create a context to reduce HIV and STD risk. Family rejection. A study in pediatrics found that higher rates of mental health and physical health problems among LGBT young adults that experience rejection from parents while adolescents. And again, you see researchers like Caitlin Ryan, for example, taking the lead on some of this research showing how family rejection ultimately increases poor health outcomes. And in the context of HIV, we see that too. Compared with LGBT young adults who experience very little or no parental rejection, LGBT young adults who experience high levels of rejection were nearly 6 times as likely to have high levels of depression. Again, depression, mental health issues, particularly suicide, these things are really key. And certainly as a social driver and a risk factor, those things definitely have to be taken into consideration. Again, you see high suicide levels with young folks that experience high levels of rejection, and also engaging in higher risk behaviors. So I want to talk a little bit about HIV stigma. I know that's certainly been a thread being woven through today. Again, the prejudice, negative beliefs, and abuse targeting folks living with HIV and AIDS. Consequences include being shunned by family, friends, and loved ones, poor treatment in healthcare facilities, being denied rights, and emotional damage. There are 33 states, according to the CDC, that where HIV-specific criminal exposure laws focus explicitly on folks living with HIV. Again, I think that's a very tangible example of a HIV stigma written into policy in our country. And I think it also, which I haven't seen this conversation being very explicit, but I mean, as we know, there are certain populations that are vulnerable to HIV that are also vulnerable to the criminal justice system, right? So I think there's a really important, intersection between poverty, health, the prison system. Like, I think we see these things being linked, and I think that's an important advocacy point to hold up. So what are some barriers to prevention that stigma sort of reinforces? Certainly accessing HIV testing, stigma can create a barrier for that, accessing behavioral and behavioral interventions. And it can also create an environment where it's very difficult to have the very important risk negotiation and sexual health communication conversations with partners and potential sexual partners. In the context of treatment, again, stigma can create a barrier for folks accessing treatment. I know previously I worked for a community-based organization, and there was a lot of conversations about what does it mean to have the word AIDS in the title of an organization? What does it mean to have on your door something with AIDS? Will that create a barrier for folks accessing treatment? And how do we both meet clients where they are, but at the same time work to create visibility and destigmatize HIV on our own? So there's a really important tension there. Kevin Fenton, again, one of the amazing leaders at the CDC, puts forth that we cannot end the Black AIDS epidemic without confronting HIV among Black gay men and the stigma and homophobia that allows HIV to flourish in our communities. He goes on to say that the stigma of homosexuality runs deep in many of our communities, and particularly for young men who are just coming to terms with their sexuality, the weight of the stigma can be crushing. Part of the reason why it's valuable to talk about this is that what stigma does, particularly anti-gay stigma, is that it interrupts the process of coming to a sense of healthy identity. You know, if you're a young person that's trying to come to terms with your sexuality and really trying to develop, you know, a sort of a healthy sense of self-identity and certainly sexual identity, stigma interrupts that. And stigma interrupts that, and it's really important to create spaces where that can facilitate healthy identity development, particularly for, again, young LGBT folks. I think the most obvious example of the intersection of HIV stigma and anti-gay stigma is the FDA blood ban. If you are a man that's had sex with other men, you are not allowed to give blood. I think the American Red Cross, certainly folks there have been doing work to kind of rethink that. As well as there have been a number of folks in the community that have really been challenging the FDA blood ban. But I think that's sort of the perfect intersection of like how, you know, these stigmas sort of operate and work together. So for example, even if you are engaged or have been engaged in other risk behaviors, there are ways that you can give blood. But if you are a man that slept with a man, or you're a woman perhaps that slept with a man that might have slept with other men, you know, you're not allowed to give blood. I wanted to talk a little bit about countering stigma. How does one counter stigma? We talked a lot about it. How do we counter it? Well, social marketing, I think, has definitely been an amazing tool for countering stigma and affirming gay identities. One example is the From Where I Stand campaign out of Atlanta, which again is seeking to promote resilience among young Black gay men and affirm identity development. Certainly the I Love My Boo campaign out of New York City, out of GMHC, was a really lovely campaign. I don't know if that picture is very clear. And I think, again, really focusing on resilience and love and relationships, and really, I'm not just trying to create, I think, you know, quote, positive images, but really creating new narratives about what it means to be young Black and gay, and I think that's extremely valuable. My Son Is My Life is an example of, you know, fathers and sons, and I think it was launched on Father's Day, initially by Gay Men's Health Crisis, or GMHC. And again, showing examples, particularly targeting communities of color, Black communities of fathers and sons, having conversations around coming out and such, and showing affirming images. I have to say that though the campaign, there were actors, I think it still kind of created a conversation in our communities around that. Testing makes us stronger. Again, another campaign talking about HIV testing, but again, showing how couples and relationships might negotiate testing and such. I want to also talk about, again, other ways to challenge stigma, certainly community mobilization days like World AIDS Day, right? Where we are having conversations and where we're having dialogues and forums. I think it promotes that. Resilience-based, certainly prevention programming and behavioral or group level, community level interventions that focuses on resilience. When I say resilience, what do I mean? I mean, not just focusing on the deficits and the problems and the pathologies that face our communities, and certainly they're considerable and not ignoring them, but also focusing on strategies and things that we're doing right and things that are working, and also using that as another path forward ultimately. And certainly culturally affirming programming. And I think this is really valuable, again, for Black gay men and young Black gay men, because what it does is it creates a space and opportunity to facilitate, again, healthy sexual identity development, which again would have implications for better health outcomes. It would have implications for being empowered. And I think really sort of in some ways countering the many structural forces that facilitate the vulnerability around HIV and other health disparities. Again, advocacy point, challenging the criminalization laws around HIV across the country, challenging the FDA blood ban, that's another advocacy opportunity, and developing messaging and engaging media around countering stigma. I just finally want to hold up the AIDS United MT Empower program. Again, it's it was launched this year on National Gay HIV/AIDS Awareness Day, and we're partnering with organizations. I think that and we're evolving. Certainly, we're looking to partner with different organizations and to ultimately bring HIV back into the LGBT conversation. Certainly, there's a way in which, and not like across the board, but there are a number of organizations, LGBT organizations, that don't do HIV work, and we want to work with them to figure out how to incorporate HIV back into those conversations. Thank you.